Now, the art of clinical medicine. What is medicine? Medicine is a science. Is it a true science? Is it a mathematical science? No, it's an intuitional science. You will see it later. So, the art of science and the science of science, medicine I am talking, has to be combined to make it effective. Unfortunately, what has happened in our country and abroad is the commercialization of medicine. And as Mr. Rakesh Sharma put it yesterday in our dinner talk, the corporatization of medicine, where each corporate want to make profits as their motive, and they start asking questions to the surgeons, physicians, radiologists, why you are not bringing enough work. More about that later. Now, let us see what is art of clinical medicine. What is medicine is nothing but clinical reasoning and decision making. You make a decision. In our system of medicine, the most important thing is the diagnosis. Once you come to a diagnosis, then you can plan out a line of treatment, the correct investigations and plan a line of treatment, and then try to cure the patient or at least relieve the patient or whatever we can do utmost for the patients. It requires knowledge, it requires intuition, it requires judgment with concern, and as you'll see later, the most important thing is compassion towards the patient, because this is going to be a very important part of our healing process. Just drugs don't heal. The way you approach a patient, the way you talk to the patient, the way you establish, as I say, an eye contact with the patient, which is sadly lacking in our busy practice. You don't have time for the patient. Now that is the whole tragedy of medicine right now. Now the clinical medicine pertains to what is known as bedside medicine. We'll see more about it in the next few minutes. It consists of first making a diagnosis. How do you make a diagnosis? On the basis of a very good history. Where we lack is a good history, a good physical examination, relevant investigations. Mark the words, relevant investigations, not all the investigations, not top to bottom. Don't get a whole CT scan of the head, brain, chest, neck, abdomen, pelvis, and so on and so forth. That is not medicine. That is not relevant investigations. Then, of course, the prognosis. You have to tell the patient, maybe you have to tell the relatives what the outlook is likely to be. In very simple terms, without frightening the patient, at the same time delivering a message that this patient is very seriously ill or whatever it is. So that is a prognosis. And of course the treatment. You have to discuss with the patient the treatment risks and benefits. What is the risk-benefit ratio? Patient's preference for what therapeutic plan he wants to do. As I told you earlier, medicine is not a mathematical science. 2 plus 2 occasionally is 4. Usually it is 3 or 5. And it's only scientific methods which, with precision, experimental proof and reproducibility and accumulation of irrefutable data, which can say that this is a valid treatment. Every physician should delight from the fact they should learn correcting the old, learning the new, which the CMEs are mainly responsible for, and perfecting the future. You should be a better physician tomorrow than what you are today. More importantly, you must be a better human being tomorrow than what you are today. That's the most important take-home message. And Pluto, 2,500 years back, had said that good clinical medicine is a marriage of scientific knowledge and human care. See this part of human care, compassion. This goes on repeating in the lectures. Care, compassion, empathy. Patients should feel comfortable. The patient should be satisfied that he has no illness rather than only you being satisfied. Of course, you should be satisfied first, but the patient should be satisfied that he has no major organic illness. Never tell the patient there is nothing wrong with you. You think he'll spend money and come and see you if there is nothing wrong with him? He has some complaints, so you have to explain in a term that there is nothing organically wrong with you. There is no reason, there is no organ dysfunction, but this symptom which is yours could be due to anxiety, tension, so on and so forth. Now please remember, when you are examining a patient, you think you are examining a patient. There are three relatives, they are examining you. What sort of doctor you are? How do you proceed with the patient? They are observing you, and they will spread the news that, well, he is a competent doctor, he is a compassionate doctor, or he is a doctor who doesn't care for the patient. So three people are examining you, you are examining only one person. This is a very important thing, and this is not being realized. So you must convince the patient by taking good history, and I say good history is not only diagnostic, but if I may permit it to use the word, it is therapeutic. Many patients feel better on a doctor listening to them. Quite a few of them have functional problems. Somebody should listen to them. You listen to them carefully, make a note, and then the patient is satisfied. Now, for the non-medical people here, I should tell you what is idiopathic. We try to hide our ignorance in big words. The bigger the words, the lesser the illness. When we say patient has got idiopathic thrombocytopenic purpura, jaw-breaking name, it means that he's got a bleeding, platelets are down, that's all. Idiopathic means I don't know the cause. So we just cover our ignorance by using these words. And I call idiopathic as idiotic on the part of the physician and pathetic for the patient. Now, caring for the patient. No physician has done a good job making a diagnosis and giving the treatment unless he cares for the patient. And in the absence of trust, there can be no faith. Now here the spirituality comes. My definition of spirituality is faith. Faith in whom? Faith in three. Faith in God, which is very important. So first, faith in God is required, that there is somebody above you who is controlling you, controlling your whatever life you have got in this earth. Second is, you have got to have to faith in yourself, that you are going to get well. Which again tells me the same thing which the previous speakers told me. There's a positive attitude, an attitude of optimism rather than pessimism, which is going to help you. And the third important thing is faith in the doctor. So three faiths are important: faith in God, faith in yourself, and faith in the doctor who is treating you. Now how do you develop faith? You can't tell me, I can't tell the patient, have faith in me. He has to develop that faith. How do you develop that faith? By bedside manners, by your history taking, by the way you are caring for the patient, compassionate, caring, and communicate with the patient. We don't do the communication. Communication should be a effective communication, or what is known as not a communication. You don't talk when the patient comes to you, don't talk about the share prices. It's clearly inappropriate for the occasion. He has come to you with a complaint, talk about him. And sometimes quite often it happens, you get a phone call. Yeah, you talk to somebody, yeah, you book a cinema ticket for me, you do this for me, and then he says, aapko kya hota hai? Then you write down one more sentence and one more phone call comes. Patient feels he is not being cared, he is not being attended to. It's a very important thing. Patient should feel comfortable. Even that quality time, I tell you, 15-20 minutes you spend with the patient is going to make a remarkable difference. And that he develops a faith in you. And that's the most important thing in curing a patient. It's not the medicine alone which works. Medicine does work, but it has to be a faith in Almighty God, faith in himself, that is a positive attitude, and faith in the treating doctor, which is going to be extremely important. Please remember that we are not gods. We cure occasionally. Very few diseases we can cure. Maybe typhoid fever, malaria, etc., etc. Relieve many times, relieve the patient of many of his symptoms. But comfort always. Always comfort the patient. What they expect from us is nothing more than this, and what we should give them is nothing less than this. And last but not the least, thank you for a very patient hearing.